let's talk a little bit about this, because this is going to affect you directly. As the COVID-19 pandemic starts to surge in the Western Cape and in Gauteng, there's more evidence that some of the real issues to worry about, the real comorbidities, the underlying conditions of diabetes and hypertension, and along with obesity. Now, it's easy to blame people for being obese or for having diabetes, but some people are genetically more prone to the disease. Others don't have access to the type of food that you need to eat to avoid it. I'm joined now by Mary-Jane Mastolo from the Healthy Living Alliance campaign. Mary-Jane, good afternoon to you. I mean, it's easy to say people should change what they're eating, but there are reasons why people eat what they eat, right?
Yes, precisely. It's mostly because of the fact that the unhealthy food and beverage industry is not regulated, and a majority of the food that you have access to on the shelves in most of the supermarkets that we shop at are food that is not necessarily always good for our health. It's either they've got too much added salt or added sugar or added saturated fat, which all of these things are the #1 leading causes of comorbidities and NCDs such as diabetes, your hypertension, and lead to obesity as well.
I mean, one of the reasons that people eat what they eat is because of price. So, for example, I mean, I would imagine that a lot of people would say you shouldn't eat too much carbohydrates, you shouldn't eat too much pap. People eat it. We eat it because, firstly, it actually fills you up. You feel full afterwards, and it's very cheap.
Precisely. And that's a problem, is that, first of all, what is more convenient to us and it's easier for us to access is it's cheap but the problem is that it's got all these other added things that are wrong, because it needs to have a longer life shelf time. And the main thing is that we need to start going back to the basics and really going back to eating your more natural fruit and vegetables, which are not necessarily expensive. They are available at quite an affordable price. But because the convenience, because of the conveniency of grabbing something from the shelf, that is why more people are prone to getting those types of food.
Well, I was going to come to that. I mean, if you walk through a city centre, if you walk through anywhere, you'll be able to find a kotte, you'll be able to find a pie, and I've got to tell you, I'm usually very pleased when I can find a pie. It's easy to find, it's got pastry, so it's got too much sugar in it, it's got meat, which is quite nice. It's not very good for me, though, but it's incredibly convenient and often very cheap. I mean, you can have what's, frankly, quite a good lunch for $20.
Exactly. And that is why we're asking for that market to essentially be regulated. I mean, so that the next time you do get a pie, you know that there's people, government behind has done everything in their power to make sure that at least the pie that you ultimately have access to doesn't have way too much excess sugar or way too much excess salt or has got too much saturated fat. And that keeps happening because that unhealthy food market and beverage market is unregulated. And so people can basically do whatever they want because they've got nobody to account to. And this is why now we are sitting and seeing our public healthcare system really struggling in responding to the number of people that are literally dying from all these non-communicable diseases.
Has there been any change, any improvement over the years? I mean, you know, you can sort of track, and you can track the changes in our diet here in South Africa, but around the world as well. And we see, for example, in some countries like India and China, people are eating a lot more meat than they used to. And then you can track the health outcomes. Have we seen our situation get better or worse since we started paying attention to this about 10 years ago?
Not at the moment. I guess where we are at the moment, we are still at the space where we're trying to educate people about the importance of looking after your diet, and it's not really a lifestyle thing, but it's really an issue of prolonging your health and looking after your health. And we saw this in the tobacco industry, where the tobacco industry started being regulated and monitored. We saw less and less people going into smoking, and thus we're seeing less and less people getting cancer. And that's ultimately what needs to happen within the unhealthy food and beverage industry. It needs to be regulated, it needs to be held accountable, because a lot of these non-communicable diseases are direct results to the diet. They are directly linked to the type of diet that we are exposed to.
So there's several things we need to try and do here. We need to try and change habits. Now, this doesn't happen quickly. I mean, you know, we all kind of eat what our parents ate to an extent as well, even though, you know, if we get more meat, we tend to eat it. I mean, where do you start with that? I mean, does a public campaign work? You must eat this, you must eat your greens. I mean, I don't respond well to that.
I mean, knowledge is power, right? At least I believe that when you know better, you do better. So a lot of people don't understand half of the labels that they see in the food that is packaged. They usually come with big English words right at the back of the package. And there are policies that we are trying to engage to address such things. And we're lobbying for a front of package labeling, where we are basically asking that at least there must be a warning label right in the front of the package that makes it easier for a consumer to be able to understand that before I pick up that packet of chips, I need to be warned, given a fair warning that, warning, this has got an high levels of sugar or salt, may lead to diabetes. So that ultimately, if I then make that choice, I have been given a fair warning, and then it'll be on me. So it's going to be, it's a change in lifestyle, it's a change in habits, but it also needs to be a change in policy as well, so that government introduces policies that protect the consumer and give the consumer more power to be able to make better eating and healthy buying options.
Do you think, I mean, so many people talk about so much about what COVID-19 could change. We're likely to see that people with diabetes and hypertension, that many of our friends, our relatives with that, you know, are going to go through a very, very difficult time. Do you think that could be a little bit of a shock and change what people eat? Or do you think when things go back to whatever the new normal is going to be, you know, you still got to walk past that quarter and buy it because salad's just too much effort?
Well, the nice thing about COVID-19 is that it's gotten people more aware about their diets and what they consume. And it's got people talking about non-communicable diseases that have been basically hiding in plain sight for many years. They are the second biggest killers in the South African public health facility. Diabetes is next to TB. And as much as people talk about HIV and AIDS and cancers and TBs, non-communicable diseases haven't been spoken about. And they are actually quite a hazard in the public health care. And they contribute to a lot of deaths in South Africa before even COVID-19. So now what has happened is that with COVID-19, it has actually shone a spotlight on NCDs, because we see that people that have got all these underlying comorbidities are the ones that are most likely to lose the battle against COVID-19. And it's because of the lifestyle and the eating habits that have contributed to them having hypertension or high cholesterol or diabetes. And now with COVID-19, they're basically losing the battle with COVID-19 because of the struggles that they continuously have with the NCDs that they're living with. So it's a good thing that now we are actually getting an opportunity to bring NCDs to the limelight, because people have kind of like been ignoring it and not having enough information about the seriousness of NCDs.
Is there a bigger conversation we need to have about the amount of meat, and particularly the amount of red meat that we eat? I mean, I don't have the figures to hand, but I'm sure if you look through the figures in South Africa, you'd see that, like other countries, we eat a lot more red meat than we used to. That's partly because we're richer, partly because it's more available, partly because of the industrial nature of farming. I'm not criticizing it, I consume it. But I mean, there is a conversation we need to have about meat, right?
Yeah, there's nothing really wrong with consuming meat. What usually is, meat is protein, and it's protein that is needed by your body to function. It's just all the other things that you put in preparation of the meat that is usually the problem, which is your oils and too much spices and all those things that end up not being good and spoiling the meat. But obviously everything needs to be done in moderation. If you're going to eat meat, please don't have a whole plate of meat without any veggies and without any raw material and wholesome food. Try and balance things out and try to keep things to the minimum. It's really not rocket science. Just don't overdo it. Keep it to the bare minimum.